Hi everyone. Today let's see about diabetics foot care. What is diabetic foot? Any infection involving the foot in a person with diabetes originating in a chronic or acute injury to the soft tissues of the foot with evidence of pre-existing neuropathy and or ischemia is called diabetic foot. What is diabetic foot care? Foot care, which involves all aspects of preventive and restorative care of the foot and ankle. And the doctor who specialized in giving the foot care are called podiatrists. What is the purpose of giving diabetic foot care? It helps to maintain mobility and function, to prevent ulcer, to prevent injury of foot, to promote early healing of foot, to prevent infection, to save the foot from amputation. These are all the purposes of diabetic foot care. Next, we'll see about risk factors of diabetic foot. Duration of diabetes is one of the risk factor for developing diabetic foot. A patient who is more than 10 years suffers from diabetes or highly risk to develop diabetic foot. And the elderly people also prone to develop diabetic foot. Third, uncontrolled hyperglycemia. Increased blood sugar level can also lead into diabetic foot. Study says that increased blood sugar, it allows the fructose to deposit over the nerves, thereby it reduces the impulses. Due to that, the patient developing reduced sensation in the foot. Fourth is peripheral vascular disease. It leads to insufficient blood perfusion to the periphery. Fifth, peripheral neuropathy. Impaired neural function at the periphery, especially in the foot, in the lower limb. And neuroischemic diseases. Insufficient blood supply to the nervous system can impair the functional ability of the nervous system, especially in the periphery. These are all the risk factors of developing diabetic foot. Next, we'll see about the clinical manifestations of diabetic foot. Early manifestations, patients will develop burning and painful feet and swelling of the foot or legs, loss of sensation to cold or touch, thickening and yellowing of the toenail, onset of red spots, blister, sores, ulcer, infected corners or ingrown toenails. Or these are all the some of the clinical manifestations of diabetic foot. There are many classifications are there to classify the diabetic foot, but now we are going to see about Wegener's classification. If the foot side of the foot is intact, means it can be graded as 0. 1 means superficial ulcer or blister. 2, deep to tendon bone or ligamental ulcer. Grade 3 for the we can give grade 3 for deep ulcer with abscess or signs of osteomyelitis. Grade 4 for gangrenous of toes or forefoot. Grade 5 can be given for gangrenous of entire foot. So this is the Wegener's classification of diabetic foot. Based on this classification, the care also get varies. Now we'll see the main features of this presentation, that is care of diabetic foot. It has 4 main elements. First one is identification of high risk foot. Second, regular inspection and examination of foot. Care of foot is the third element. And fourth is education of patient as well as the family. First one, identification of high risk foot. The examiner or the patient every day need to check his feet and toes, and in between the toes, soles and the heels for the following early signs. What are the early signs? Tingling sensation, cold feet, ingrowing nails, decreased arch of the foot, blisters or calluses, cuts between the toes, irritations or lesions, or developing the red spot. These are all the early manifestations. So all these things has to be identified. If it is present, we can consider that particular person is the high risk to develop diabetes food. And second one is regular inspection and examination of the food. Every patient every day morning has to check his food with a mirror. So with this, in the mirror, he has to check for developing any cracks, cuts, lesions, blisters. If anything is there, he has to notify these signs to his physician immediately. And then going to consultation, regular consultation with the podiatrist, it's very essential to safeguard the food from the diabetic food. And third one is care of the food. So they have to, the diabetic patients has to care their food very carefully. So they have to wash their food when they go out and come in. And before they wash their food, they have to check the temperature of the water. As they have reduced sensation, they cannot perceive the real temperature of the water in the food. So they have to check the temperature. Too cool and too hot has to be avoided. They can use lukewarm water with mild soap. They can use for their food care. And after cleaning the food with the water, they have to dry it very clearly, thoroughly with a towel, and they have to apply the moisturizer. Moisturizer will not allow the food to develop the cracks, cuts, and sores and all those things. So applying the moisturizer is also essential. And cutting the toenail is another feature. So the toenail has to be cut straight. The corner of the nail not to be cut because it may hurt the skin. That way they may develop the lesions. Then appropriate size of shoes is very essential. Too tight or the too loose shoes can cause injuries to the skin. That way they may develop the diabetic foot. So selection of the appropriate size of the shoe is essential. And whenever they are going to wear the shoes, they have to examine the shoes clearly, and then they have to check any presence of any nails or the insects. As they have reduced sensation, as they wear, once they are wearing, they cannot identify its presence. So before wearing itself, they have to check for the clarity. And last, not the least, education of the patient and the family on diabetic food. First one is good diabetic care is very, very essential. They have to keep their glycemic control less than 7. If it is more than that, they are in a high risk list. And then lifestyle modification, that is stop smoking and alcohol consumption, and performing everyday exercises. Thereby they can keep their weight under control and avoiding the high fat diet. And maintaining the diabetic diet is all kind of a lifestyle modification. They have to follow it regularly. That way they can keep themselves under the control and under the normal control of glycemic index. And protective footwear is essential. The footwear, whatever they are wearing, they have to use an appropriate size, and it should thereby they can protect their foot from developing the injury. Hope you have learned some of the salient features of the diabetic foot care. Thank you.